Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today is St. Patrick's Day. Please remember to adhere to all public health measures and regulations in the red zone. Staying home if you are sick and minimizing your contacts is important. Today we are reporting an increase of 30 new cases of COVID-19 in Windsor and Essex County. Of the 30 cases, 8 are close contacts of confirmed cases, 2 are related to an outbreak, 1 is community acquired, 1 case is travel related to Michigan, and 18 are still being investigated. We've had 13,475 cases since the beginning of the pandemic. 12,801 cases are now resolved, and 273 people are active at this time. 38 preliminary or confirmed variants of concern cases have been identified in Windsor-Essex, and 2 cases have been confirmed as the UK variant. 24 confirmed cases are currently in the hospital, and 4 people are in ICU. We have lost 401 people to COVID-19. There are currently 8 active outbreaks in Windsor and Essex County, 2 in long-term care and retirement homes, 2 workplace outbreaks, and 4 community outbreaks. Just want to provide an update about the vaccine rollout. So right now we have the pharmacy rollout with the AstraZeneca. So locally we have 57 pharmacies that are participating in this rollout, targeting adults aged 60 to 64 years of age. To book an appointment, go to ontario.ca/pharmacy COVID vaccine, and you'll be able to book online or call one of your local pharmacies that have been advertising that they have the vaccine. Yesterday, NACI, the National Advisory Committee on Immunization, expanded its recommendation for the use of this vaccine, AstraZeneca, to include people 65 years of age and older. At this time, our pilot study remains at 60 to 64 age group, but if there's any change, we will inform the community through the media and on our website and through social media and our email subscribers. We also have clinics going on for those over 80 years of age, and to date, we have vaccinated 5,120 residents over the age of 80, and we are booking over 700 people a day right now. To book for the over 80 clinic, you must first pre-register on our website at wech.org or call 519-251-4072, and then you'll be called by our health unit to schedule an appointment. To date, we have administered a total of 51,636 doses of vaccine in Windsor and Essex County. We ask for your help in checking in on your family and friends who are in any of these age groups, both 60 to 64 and over 80, and encourage them to get their vaccine, help them register, make an appointment, help with transportation, do whatever you can. And, I think that would be appreciated. I just wanted to give a comment as well related to our opioid alert that was released yesterday. Our health unit monitors drug-related overdoses in local hospital emergency rooms, including opioids and crystal meth. We inform our partnering agencies that are all involved in the opioid and substance strategy for Windsor-Essex County, and they use their networks to inform their clients. So by putting out this overall community alert, we are alerting people that the rate is much higher than we've seen in previous years of the same time period. And in this particular case, it's in the past 5 years. We haven't seen these overdoses at this rate. This can be due to, changes in drug supply or other factors. So we are just wanting everyone to be aware. We know that based on our community engagement and that we reported in 2019 around safe consumption sites, we were told that people are injecting alone. So we want to ensure that people don't inject alone. So again, reach out to people, check in on them. Give them, make sure that they're aware that that they know what the substance that they're using, that they have access to naloxone, and that we continue our work toward a safe injection site in our area. And seeing the numbers today, we will continue that work, and we are moving forward. So I guess the final message is just to check in on your neighbors, friends, family, and help them access the services they need at this time, and we'll all have a good St. Patrick's Day. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Yes, good morning. For the vaccine rollout, last week we spoke about having to cancel the second appointments made for 80-year-olds. Would those end up being rescheduled, or will they just be called at a later date to schedule their second vaccine appointment?
So we are calling and have called and are canceling, and we are not rebooking appointments at this time. We'll have to get in touch with everyone again. I believe there were probably closer to like over 1,000 people that we canceled appointments, but they are not being rebooked at this time. And it is still a 4-month, for the second dose for anyone that attended the mass immunization clinics or the clinics for those over 80.
So all of those people who've gotten the first doses since then, they have not had their next appointments booked either. They'll be booked all at the same time? That's
right. So anyone who's had their first dose has not had their second dose. Even with AstraZeneca, it'll be 4 months down the road. The Pfizer is 4 months down the road from your first dose. The only second doses we're giving right now are to residents in long-term care and retirement homes. If they're a new admission and have not been vaccinated, they would get the vaccination, which is Moderna, and that will be given on schedule at 28 days.
And speaking of long-term care homes, you were able to clear 2 outbreaks. There were 4, now there's down to 2. How does it feel to be able to see that these cases within the long-term care homes are not spreading like they once were, that perhaps the vaccines are doing their job?
Yeah, it's a very good feeling. And you can, anyone who's been following, the numbers and the outbreaks, you're absolutely right. You can see the decline. So let's hope that continues. It was a good feeling today to see, like, we have a lot less outbreaks. And we do know that if you're looking at a group of people that have, a high vaccination rate, it's in the long-term care and retirement homes. And so that is good to see.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Teresa. At this stage, do you know if plans will be announced soon about vaccinating people who are eligible for the vaccine right now but are housebound, people that can't get out to those vaccine clinic locations?
So we are working with the community and home care through the LIN. And we know that there are people that are not able to get out and would qualify as, adult recipients of home care. And we will likely work with our healthcare partners to get people vaccinated when we're able to and bring it to their homes. So we do know that there are probably 100 people that absolutely cannot get out and see either their physician or another means of getting the vaccine. So we're working on, plans to use our EMS partners to help with that.
And I know EMS has been going out to senior apartment buildings that particularly cater to seniors already. Do you have a sense of when they may be able to go out and reach these recipients of chronic home care, or even maybe elderly people who are not mobile?
So we're doing it as well. So our health unit, we have a small staff as well that are doing outreach and doing the mobile vaccinations. So we're doing as much as we can with the vaccine that we have right now. We are increasing access to some of our healthcare providers as well, our primary care health teams. So there should be more access to the vaccine at different points. So we will continue to work with, our partners and internally, and also with our organizations to identify people that need the vaccine and try to make sure they have access.
In the organizations, would that be at places that maybe provide home care, send out PSWs, registered nurses to individuals' homes?
Yes, and we have talked about that, where there are some agencies that have the ability to do the vaccination in home, but with Pfizer and Moderna, the transportation of that vaccine is not really, ideal for that kind of a transportation and, moving it from home to home. So we will have to see what other options are available, but that's part of the, the issue is the moving the vaccine.
Thank you.
Any questions from AM 800?
Teresa, Mayor Dilkins was on our station this morning. He talked about the homeless population, how the vaccine will be rolled out to them later today. What part does the health unit have in this? Will it be your nurses administering the vaccine?
I don't believe we're doing the homeless population ourselves, vaccinating them. We are working with the I believe the CREST group that were doing the testing, that they were participating in the vaccination, but we are coordinating all of that to get that done or started anyhow, not done, but started.
Just looking at the outbreaks, and 4 of the outbreaks are related to, I guess, that population. Just to get the vaccine rollout started for that population, I'm guessing that's a huge bonus to hopefully control some of these outbreaks?
Well, it won't be immediate. So public health measures and, are still necessary. So this will help. But right now, we do know that people are still recovering from COVID and they wouldn't be eligible for the vaccine. So in time, it's a good start, but we will have to make sure that the majority of people get vaccinated. And again, the vaccine isn't effective the day you receive it. It'll take a couple weeks. So public health measures are still very important. We don't know at this early stage yet that, even with being vaccinated, you still may be able to transmit the vaccine, or not the vaccine, transmit the infection. So you want to, you still have to adhere to the distancing and the masking and all of the public health measures. So a vaccine alone won't control everything immediately.
And then one final one, just looking for clarification. The mayor said this morning as well that, and I know you stated it before, as of right now, at the WFCU Center, about 200 people, less than 200 are getting administered. He said starting next week it's going to be 2,000. Is that 2,000 just at the WFCU Center, or is that just at the 4 sites that will be starting on Monday?
So I was looking at these numbers earlier today, and now I'm drawing a blank completely, but we know that at WFCU, we have been doing about 336 doses a day. And then next week, so that's March 22nd, next week will be our first week of going to 7 days at the WFCU. So 336 times 7. And then we're doing the Nature Nature Fresh Farms Recreation Center in Leamington. And we're doing not as many, but we're doing quite a few there as well. Every day they're a 5-day schedule. And in addition, starting next week, the Sportsplex will be immunizing people over 80, and also the old Windsor Star building, which is part of the University of Windsor, called Windsor Hall. So next week you will see a lot of sites and availability for those over 80. In addition, the AstraZeneca rollout with the pharmacies will continue, and people 60 to 64 should be accessing that for their vaccinations. So next week will be a a busy week, and we'll use lots of vaccine that we, have been allotted to our area, so that's all good.
Sorry, just to that point, is it safe to say we're getting a steady stream of vaccine coming to Windsor-Essex now?
Well, I will say we're getting a stream. We do know that the next couple weeks there is a little extra, and then it does drop off in the first 2 weeks of April a little bit. So we're monitoring all of those doses, but it is coming. So yes, it's steady.
Thank you.
Any questions from CTV?
Yes, hi, good morning. So we heard last week that individual health units would need to approve the OHL's return plan. Has the plan been approved, or are there any updates there?
I have not heard anything about the OHL, and I know that was asked last week, but Mike is writing it down, so he will follow up. But I have not seen any plans, nor have I heard of any of our staff reviewing plans for hockey, the OHL.
Thank you. And I know this was touched on yesterday, but just with St. Paddy's Day celebrations, what can enforcement be expected to look like today?
So we do have our TVEOs, they're the tobacco vaping enforcement officers. They'll be working today with local bylaw and into the evening to ensure compliance. So it would really be around the social gatherings, the restaurant capacity, and adhering to all public health measures. So they will be out and about today and this evening.
Thank you.
Any questions from CBC?
Hi there. When answering the question yesterday about regarding when the third wave is here, you noted that the unit was finding people had more contacts than usual. I'm wondering if you have any data or numbers to share and how concerning that is for the unit.
I don't have any further numbers. We do our EPI summary on Fridays, and that will continue this, in a couple days. And we'll have more information then, but you can see that as I report the numbers, the number of close contacts seems to always be the highest number, and that's always related to the number of contacts a case would have that are deemed higher risk. So being in close proximity without proper personal protective gear like a mask. So that continues to be the reason for our increased case counts are these close contacts. And but on Friday we'll have all of that information because our EPI is keeps track and then provides a good overview on the Friday broadcast.
And I'm also wondering if recent information regarding the AstraZeneca vaccination and kind of contentious information regarding blood clots, I'm wondering if the public health unit may be planning an information campaign, for example, to better inform people to kind of give them reassurance about the vaccine.
Well, we do have good information on our website, and we do want to give that reassurance. The AstraZeneca is a good vaccine, and it is accessible to us. It's not accessible across all health units, so we are a pilot site, and I would encourage everyone to get the vaccine that are within that age group. There's no concern that should make people hesitate to take a vaccine that's available to them at this time. And we will continue to provide information as it becomes available to us. We know that Health Canada and NACI released a statement yesterday, and we're doing our best to inform all of our partners, healthcare partners as well, to encourage the safe and effectiveness of the AstraZeneca vaccine for those right now 60 to 64, but that could change as well.
And I also wanted to know if there have been any additional discussions on adding or strengthening protections for migrant workers regarding COVID outbreaks, preventing them.
So are you talking about the relative vaccination for Agrifarm workers?
Yes.
So they would be classified, prioritized in phase 2 of the vaccination rollout by the province. And we do have plans to vaccinate this group when we're able to. And in all likelihood, it will be at the Nature Farm Fresh Recreation Center, the Old Shirk Center. And you know, we will be offering the vaccine when we're able to and get that, you know, make sure everyone has access who wants a vaccine. So that will be coming. I'm not sure exactly when, but, you know, when we're done the 80+ group, for sure.
Okay, thank you very much.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, Teresa, do you have any update on the outbreak at the Southwest Detention Center?
No update other than what was shared yesterday, and you know, nothing further that I'm aware of.
Okay, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
Yes, just following up from a question from yesterday, is there any update regarding the farm worker from Jamaica who passed away over the weekend?
I'm sorry, I don't have any information on that person. I'm sorry.
Okay, thank you.
Any additional questions from CBC?
No, thank you.
Okay, thank you, everyone.